Whether you're a locum, a new starter, or a practice manager who wouldn't mind a freebie as part of the induction of their new staff, prepare to be initiated. Before we start, we will assume that someone has helped you out with logins and things. When you load up best practice, this is the main page, and there are a lot of icons here in the top left-hand corner, but the only one that you really need to concern yourself with is the appointment book icon. When you click on the appointment book, that will show you all of the appointments that you have for today. Now, initially, when you click on this before having used best practice, this will probably be unticked and this will be ticked. It is basically showing you all of the appointments for all of the clinicians at your practice, regardless of whether they are working or not. Now, as you can see, there are a lot of empty columns here and you kind of want to get rid of that. And the best way to do that is to click on this box, hide providers without available sessions. Now, as you can see, it has really simplified things. At the moment, it is showing you all of the clinicians available at the practice. But what I personally would suggest doing is finding yourself in this little box here, clicking on yourself and then clicking on selected. This way, you are basically only seeing your appointments. My clinic starts at 11 o'clock today and it finishes at 7:30 is my last patient. Now, one thing I'll also mention about the appointment book is sometimes if you're clicking around on different dates, it is easy to get lost, and the easiest way to get back to where you want to be is just clicking on today. And that will automatically bring you back to today. If your appointment is a face-to-face appointment, then your receptionist will arrive the patient for you. So what that means basically is they will right-click on the patient, go to change status, and click on arrived. Their name has changed to yellow. Now, if you want to open the patient file from here, you basically just double click on the patient. And this is what happens when you load up the patient file. In the top left-hand corner here, you will have all of your patient's details. So their name, their address, their Medicare number, occupation if you have added that. And I can show you how to do that in another video. You have the date of birth, the age, and their contact details, whether they smoke, alcohol. This is actually a really useful area here, just to get a quick glance of who you're dealing with. As you can see here, there is a timer that's ticking away. This is obviously relevant because the Medicare numbers that we bill often will depend on the time that we have spent with the patient. If you want to learn more about that, I do have a video and I'll include a link in the description below. Right underneath the patient details, you have the allergies, which can be quite useful. And right next to it, you have the notifications, which are kind of little reminders for you. So that's something that's always worth having a look at when you are seeing someone for the first time. Obviously, if time permits. Now, the little box here on the left-hand side is probably the most important bit when we're talking about your patient file. Let me go into a test patient and I can go into a bit more detail of what these boxes actually mean. So this is our test patient Cherry Ripe. And if we go down to the box on the left-hand side that I spoke about already, the first thing you want to click on is today's notes. And this is where you basically fill in your details. What I would probably suggest at the start of your consultation is make sure you choose the right visit type. And you can do this in this little box here. If this is a face-to-face, you're going to be wanting to click on surgery. If it's a telephone, then you would click on telephone. And this is obviously important for medical legal reasons. Now that I've put in a little bit of a history, I will often follow up with an examination, if relevant, of course. And personally, how I like to do examinations is I like to code the examinations. And we can talk about this in a little more detail, but if you want to bring up the examination box, you basically just click on Alt F3. And the reason why I code observations, and especially when it comes to blood pressure, is that you can have a little graph here that will show you when this patient has had an examination, when they have had their blood pressure recorded, and get a sense of how things are going. As you can see in 2020, this fake patient had a blood pressure of 100/60. And then in 2021, it was 87/142. So something is obviously not right there. And at this point, I'll basically just pop in the details 120/80. And I will also record the pulse very often. Something that I find is really important, and especially when you're consulting with kids, is to record their weight. And the reason I want to do this is because if you code the weight, then that will be transported into the centile charts, and we can talk about that in another video. And if you go back to today's notes, you can see that it has already put in an examination and a general. If she has some concerns related to her chest, I'll basically just document chest clear. At this point, I'll document a plan, which I've outlined below. So this is basically your current consultation. Now, if you want to see the past visits, you will go down to the left-hand side and click on past visits. And as you can see, these are the doctors that have consulted with the patient, the reason for the consultation, and you can see there's not much filled in here. But nowadays, once you finish a consultation, it will usually prompt you for a reason for visit. And that can be really great to go back to previous consultations that pertain to that particular thing that you're talking about. There will be a visit type here, which we've spoken about already, the start and stop time, and the duration of your consultation. You can see that the timer is ticking away here. And finally, who recorded the consultation and when that was recorded. So when you are documenting the reason for visit or the diagnosis, and you can see this at the bottom of today's notes, at diagnosis, procedure, reason for visit, that will typically pop up in the past history. So I'll just give you an example here, and I will add anxiety and save. As you can see, if I go into her past history into the active problems, anxiety will be here with the current date. If you want to look at her inactive problems, then you basically just click on that little plus sign and that will open up for you. Let's say Cherry Ripe has recently had some bloods and you want to have a look at them. You will go into the investigation reports, and this is where all the blood tests live. And this is also by and large where all of the imaging comes through. And if you want to have a quick look, you just basically double click and it will show you the results. If you want to go back to the list, you just click on back to list. If there are any letters from hospital or specialist or physios or psychologists, then they will typically appear here and usually start from the column from, so who they're from. Jason Martelli, so this is some kind of home medication review referral. Correspondence out, these are all of the letters that you have created. And I will show you how to create letters and how to create referrals. Finally, something that's really useful is the past prescriptions. This will have a list of all of the things that your patient has been prescribed in the history of your patient, effectively, so this can go back quite far. And this is really useful if you want to re-prescribe something at the same dose. You basically just right-click and re-prescribe. When we are talking about medication and we want to prescribe a medication for our patient, you go into current prescriptions and you click on add. And at this point, you basically find the prescription that you're looking for instance, sertraline, choose the dose that you want. Let's say in this instance, I want sertraline. There's often a little bit of a warning here for you. Click on continue. You will put in your dose once daily. Click on next. You have to decide whether the prescription that you're doing fits the PBS criteria or whether it falls outside of those criteria. So in this case, we're using sertraline for anxiety. Let's say Cherry Ripe has a history of panic disorder. So we're going to prescribe this on the PBS. You have to decide whether this is a one-off prescription. And as you can see at the top here, you have quantity and the amount of repeats. If you click on one-off prescription, that number of repeats will go down to 0. If this is long-term medication, the repeats will go up to 5 or how many are allowed on the PBS. And you basically choose the reason for prescription, which is anxiety in this case, and you finish. Once you have added that prescription, you can see that there's a little tick in the tick box here. And that means that you can print out that prescription. So if I click on this and click on print, that prescription will print out. If you have eScripts set up, so either to their mobile phone or to their email, you click on eScript and that will send through to them. Right, so let's say at this point that we want to do some routine blood tests. Now where you will find the blood test is here in this little test tube, and it's called pathology request. You basically click on this and a new window will pop up. You can either choose the test that you want, or you can basically just free type in the other box. And what is often a good idea is to add in some clinical details here. So annual health check, for instance. When you're done, just click on print and that will print out for you. You can give it to the patient and then the patient goes to the path lab and they have the blood test done. And similarly, if you want to request some imaging. So let's say in this case, her chest really isn't getting better despite a few courses of antibiotics and you want to get a basic chest x-ray or a low dose CT. You will go into the imaging request, which looks like a little bit of a chest x-ray. And if you click on that, another window will pop up and you can basically choose at this point what kind of test you want. In her case, let's say we want a basic chest x-ray, cough for 6 weeks. Print, and then similarly, she can take that request to the radiology department and they can do that test for her. Now, there are two more things I want to show you. The first is how to do a referral, and the second is how to do a medical certificate. And they're actually right next to each other here at the top. If this is the first time that you are using best practice, then there will be nothing here for you. So what you have to do is you have to click on add, and then you have to find the document that you want to add. So let's say I want to do a referral. You can see that there are a few referrals here already. Again, this will be set up by the practice that you're working in. And if I double click on referral, it will pop here as a commonly used letter. And if you double click on that, you can see that the referral is starting to load up. You can put in the details of the person that you want to refer to, and you can also include any tests that this patient has had recently. Now, to be honest, this is completely up to you. I will often do open referrals. So rather than specifying one person, I will generally just do the specialty. So dear cardiology, for instance. If you want to print out the referral, you can click print. Although if you do have emails set up, then you can actually click on the little @ sign and you can send an email to the patient. However, if you are sending emails, you probably have to figure out a way to add in your electronic signature. And if you want me to create a video about that, feel free to leave a comment below. And the last thing we're going to talk about are medical certificates, and they are right next to the new letter. A window here will preload for you. And at this point, you can choose from the drop boxes what this medical certificate pertains to. So they will be unfit for work, and then you can choose the date. If you want to backdate, and there are very specific rules of when and how you can backdate, you can choose the date here, and then similarly to date. Sometimes parental leave is required, and if it is, you just click on it. Click insert, and there's your medical certificate. You can basically just print that out or add in your electronic signature, and as before, just click on the send mail icon. And there's one last thing I want to show you, and this is probably pretty important, is how do I charge the patient, or how do I charge Medicare? And that's up here at finalize visit. Once you have finished everything, click on finalize visit, and this is where your billing box appears. So depending on how long the consultation is or how complex it was or what kind of things you did for your patient, you will basically put in the MBS number. And in this case, it is a consultation under 20 minutes and it was pretty straightforward. I'll put this through as a 23. If you want to bulk bill your patient, you will change the account type to direct bill. Now I have spoken about bulk billing and private billing in the Medicare video. So if you're new to this whole billing thing and you want to learn a little bit more, feel free to click on the link in the description below. Now, if you are privately billing the patient, well, you will go down to the practice private fee. Obviously, there are a few other options here. Let's say they're a pensioner under the age of 75, or they're a pensioner or student, and you would choose the relevant box. Once you have finished, you just go to save and close. Right, and that's pretty much the end of your consultation. Now, once you have finished your consultation, you can go back to the appointment book. The patient that you have finished seeing will turn green. And that's a signal to the receptionist that they can charge this patient or charge Medicare, depending on whether you're bulk billing or privately billing. And then the next step is you just wait for the next patient to come in. Once they get arrived, they turn yellow, you double click on them, and you follow the same steps that I've just shown you.